Estrogen causes breast cancer. You do not want to do bioidentical hormones, and they're talking about estrogen because it's going to increase your risk of breast cancer. So don't take it. Don't get the benefits of taking estrogen when you're going through menopause. Just deal with the hot flashes, the poor sleep, the weight gain, the pain, etc. that goes along with that because it's going to prevent you from getting breast cancer in the future. Go back to the root cause with Dr. Jake. I'm Dr. Jake Schmutz. I'm a naturopathic medical doctor and integrative physician. On this channel, I have real conversations with real patients to show you how to heal your body down to the root causes without harmful drugs or surgeries. I'm here today with my co-host and patient, Theresa Marie, to talk about what are some of the causes of breast cancer.
Dr. Jake, I'm really eager to be able to hear this from you because 45, I'm almost 46, and I'm getting into that age range where I'm starting to see my peers getting diagnosed. And I know a lot of people in my age group and even younger are now eager to see like what are some things that they could start doing or not doing in order to prevent the possibility of getting it, because it seems like breast cancer it feels like it, but maybe I'm wrong. Is it the number one cause of cancer in women?
It is the number one cause of cancer in women, yeah.
Okay, so because of that, I think this is a very important conversation to have. And I'm eager to see what the science is showing and what we can do about it, because I don't want to feel hopeless at the end of this. I'm hoping that what we learn from you, there's some action steps that we can take based off of this in order to reduce those chances as well. So let's start. What are some of the ways, lifestyle choices and things that we're doing that can increase our chances of getting breast cancer?
Yeah, so there's a lot of things that you guys are probably not going to like me for what I'm going to talk about that increases the chances of cancer, but this is very validated by science. We have a lot of great epidemiological studies to really see what actually increases your chance of getting breast cancer in the future. So I'm going to start with one of the big ones. So it is birth control. So that includes the pill form of birth control with estrogen and progesterone, both forms, and also a hormonal IUD, not a copper IUD. We don't have data on that a copper IUD increases. It's actually the hormonal IUD. So why is that? The thing is when you don't, it decreases your cycles or dysregulates your cycle. Women need to have that monthly detox, but also the monthly cycle of hormones going through the appropriate cycle. So hormones are always going through this cycle every month, and it needs to be regular and regulated. But if you mess with that, which you want to do to not have babies, but if you mess with that, there's more than is happening to your body than just having babies. It's dysregulating your hormones. And then this has a effect on the breast tissue and increases your risk of breast cancer in the future. We're seeing that. We have a lot of, like I said, epidemiological studies. And these are studies that we're tracking people over time for 20 or 30 years. And what are they doing that? And we see people, women that get breast cancer have much higher use of birth control than women that don't. So unfortunate. I know it's really great to not have babies or have babies when you want, but we are seeing in the data that maybe we need to use other forms, non-hormonal forms, as birth control.
So as far as like a takeaway that I'm seeing in this situation is for women who, if not getting breast cancer is a serious thing that you want to do, if you have a hormonal IUD, get it taken out. And if you're taking birth control in order to prevent pregnancy, do something else. A diaphragm, condoms, those types of approaches are going to be much better for you. And there's even like the rhythmic method that a lot of people, if it's done right, can be effective when it comes to preventing pregnancy. So that's something that we can easily do right now. May not be enjoyable, but it seems that makes sense to me, right? Because birth control is disrupting that regular cycle by interfering at the hormonal level. All right, Dr. Jake, what else do you have for us?
Yeah, and along those lines is okay. A lot of women, I know a lot of women listening to this are like, yeah, I took birth control. Oh crap, I'm screwed now. All it does is say, okay, your risks are higher. So you need to be more aware and cognizant and be like, okay, I use these. My risk is higher. What I need to make some changes in my life. I need to improve my diet. I need to exercise. I need to actually go to a doctor to help me order the appropriate labs so I know how to improve my immune system or how to decrease my risk from where I'm at now. So it could just be like, okay, I am at an increased risk. It's more than just, okay, I have a bracket A and 2Z. I'm sure a lot of people have heard of that. That's an increased risk too. It's a genetic marker. But the stuff I'm going to be talking about is, okay, my risk is a little higher. So let's do the right things because it is. It's not like a death scenario. It's not that. It's just your risk is higher and you just need to make some changes so you can not get breast cancer in the future. So now we're going to talk about And this is something you can't absolutely do yourself, but maybe when you're having kids, you can think about this, is the earlier of menarche. And what that means is the earlier that a woman starts her period, the more increased risk that person has later in life of getting breast cancer. So a little girl that starts, and they're doing this now, having the period at 8 years old, which is sad. And it's really the hormonal disturbances that are happening, the hormones in our water, toxic exposure, etc. And that increases the risk of breast cancer. And the later a woman starts menarche, like if you're like 14 or 15, maybe even 16, sometimes women start freaking out because they haven't had the period, then it's actually beneficial long term of preventing actually having breast cancer in the future, the later you have your menarche. So paying attention to estrogens in our food, in our water, when you are a mom for your future kids is important. So you could actually possibly prevent breast cancer in them in the future by just looking at these toxic exposures and eliminating these in their life, because that's where early menarche happens, is having way too much estrogen in their body, and it causes that to start early.
I lucked out in that I was one of those later menarche, starting at
Yeah.
14 years old, almost 15 when I started.
Mm-hmm.
But you're right. I mean, I know that actually was very abnormal. I was very embarrassed by that fact
Mm-hmm.
because all of my peers had already started. Knowing this information, it helps empower me for my own daughter. And one of the things, she's 10 years old. Actually, she just turned 11. So far, so good. No period yet. But what I'm also doing to help make sure that her period starts at a good, healthy age is making sure, like the newest trend right now in this age group, it wasn't like that when I was a girl, but this alpha generation, they're really into skincare. And it's like, I didn't even know anything about skincare at age 11, but my daughter knows so much. But making sure, like, okay, I want to be able to help you explore this, fun trend and taking care of your skin and looking nice and all that, that's fine, but making sure that she's not putting creams and so forth on her skin that could be interfering with her hormones. So really looking at the ingredients and making sure
Mm-hmm.
they're clean.
Perfect. Yeah. So going along with age two is the later that you have menopause, the increased risk you have for breast cancer. So normally breast cancer, menopause is around 52 years old. So some women are freaking out that they're going through menopause at 45. Okay. But it's actually beneficial what we see in the data. If you go through menopause at 45, you will have a decreased risk of breast cancer. And if you keep on having periods up to 56, which some women do, which is, I'm sure a lot of women are like, I hate that, but some women do, and that increases your risk of breast cancer in the future. So this is good to be aware that, okay, I had late menopause. There's some things I could do. I need to talk to a doctor and look at things that I can do to prevent getting cancer in the future, because my risk is a little higher because of that. Another thing is having children. So just having children decreases your risk of breast cancer. And it's interesting thing is the more children you have, the better is that what we're seeing. So if you have 5, 6, 7, you actually have decreased risk of breast cancer. Now, if you just have one, you do have much decreased risk than one that didn't have any children at all. And it is those hormonal fluctuations that happen during pregnancy. And then going along with that, another one is if you breastfeed, that decreases your risk of breast cancer. So having children and then breastfeeding does greatly decrease your risk of breast cancer. This does not mean if you have children and you breastfeed, you're not going to get breast cancer. But we are seeing that women that don't have an increased risk of breast cancer. So if you are in childbearing ages, I definitely recommend that you breastfeed, not just because your baby's going to be better well off, their immune system is going to be so much stronger, their brains are going to develop better, but it's also very good for the mom. So it's a double whammy effect. Baby is getting great benefit, and then the mom is getting benefit too. Now, obviously, there's some that can't breastfeed and they didn't lactate very well, and that's just their body's there, and there's nothing you can do about it. But if you do have the option to breastfeed, I recommend it for the baby and you. Next thing, I think this is a very interesting one, and this is like what everyone talks about is estrogen causes breast cancer. You do not want to do bioidentical hormones, and they're talking about estrogen because it's going to increase your risk of breast cancer. So don't take it. Don't get the benefits of taking estrogen when you're going through menopause. Just deal with the hot flashes, the poor sleep, the weight gain, the pain, etc. that goes along with that, because it's going to prevent you from getting breast cancer in the future. But what we are seeing is that is way too simplistic. The big reason what we're looking in the data of the Nurses Health Study is, okay, yeah, women that were taking estrogen had increased risk of breast cancer, but they didn't look at how much estrogen they were taking, how little estrogen they were taking, Were they balancing it with progesterone or testosterone or other hormones? Because that's how our body naturally works. They didn't look at that. They just looked at estrogen. But what we're seeing in later data, a more modern data that we're seeing now, is if you take estrogen, you want to balance it out with progesterone and testosterone and DHEA because those they regulate. It's about a balance between those two. If you have way too much of one hormone, it's going to dysregulate all the others. So it makes a lot of sense symptomatically that you're going to have all kinds of these hormonal symptoms, but also makes sense that it's going to increase your breast cancer risk if you have way too much of one hormone, especially estrogen compared to the others. We're symbiotic organisms. We play off of each other. And that perfect balance of hormones helps prevent breast cancer. So if you are taking estrogen or bioidenticals, you want to balance it out appropriately with estrogen, progesterone, DHA, and testosterone. Go to a doctor that knows how to balance this out appropriately and is ordering your labs appropriately. Also, you want to make sure your estrogen is not way too high. Don't get it way high. Check with the doctor, get it checked to make sure that it's at least below 50. And you want to be taking a good amount of progesterone and testosterone to balance it out.
So what I'm hearing then from you, Dr. Jake, is oftentimes when I hear women who do have breast cancer, I'll ask them, I'll say, are you estrogen dominant? And almost all of them are like, yeah, that's my big problem. So it
Yeah.
seems like estrogen dominant means you have high amounts of estrogen. And I assume alongside that is an abnormally amount lower progesterone,
Mm-hmm.
or at least where the
Yeah.
balance isn't there. Maybe it is normal progesterone, but because the estrogen is so high, there is an imbalance. And maybe offsetting that with some progesterone and testosterone to balance it out, or doing something to reduce that estrogen so that it's a little more balanced with the progesterone and testosterone. All sorts of possibilities depending on each individual woman's profile. Now, here's a question for you that I'm hoping that you have an answer, and I'm hoping that the answer will help make me happy, but I'm here for truth regardless. You had mentioned prior that having a menopause later actually increases your chance of breast cancer.
Mm-hmm.
Then we're seeing this about the HRT situation. It's like, okay, HRT isn't bad as long as you have a good balance with progesterone and testosterone. So, what about in the case of the 45-year-old women, like myself, who was starting perimenopause, got on HRT with progesterone and testosterone? I'm doing it right. I'm doing all three. But isn't that going to slow my onset of menopause? And then how does that work if if a late menopause increases my likelihood of cancer, but taking HRT good balance is okay? What does that picture look like for women who are using HRT to either minimize the effects of their menopause or possibly postpone?
That is a great question. So, what we're seeing in the research is that they didn't necessarily look at late menarche in these patients that were taking estrogen and progesterone, but they did see that women that were doing a balancing effect of estrogen and progesterone and testosterone, they had decreased risk. So, if you're delaying like you're having periods longer because you're doing hormones, my best bet is that you're in good shape because you're balancing it out. A lot of these women that are having late menarche, they do have that estrogen dominance. They have a higher estrogen compared to progesterone, and that is leading to them having later menarche and having way too high of estrogen, and it's not balanced out by the progesterone.
So what I'm
Now, I
hearing from you
believe,
is that these women who maybe are not starting their menopause until later, yeah, they're not starting menopause until later, still having a period, but they have low progesterone, low
yeah,
testosterone, they're high on the
mm-hmm,
estrogen, and that's the problem. It's
yep,
that's actually the root cause issue more so than
yeah,
anything else. That makes sense.
yep,
Okay,
mm-hmm,
Dr. Jake, thank you so much for that. So a lot of what you've talked about really seems to revolve a lot with hormones.
mm-hmm,
Birth control affects hormones. Obviously, starting your period is early onset of hormones. Later menopause has to do with hormonal imbalance. Not breastfeeding does actually, it is interfering with your hormones in some way, shape, or form. Not having children or having them your children too late is affecting hormones as well. HRT, it's all seems to be hormonal. You have
yeah.
another one here at the bottom that seems to be a little different than the rest. What's this last lifestyle choice that increases the likelihood of breast cancer, and why is it on this list?
Yeah, this last one is a very interesting one. And this is new data that we have coming out. And it's like, oh crap, I've been doing this a little bit in my diet too. But is actually using emulsifiers like carrageenan, which is in our almond milk, right? I'm dairy free, so I drink almond milk. I did do it with carrageenan for a while before I was smart enough. I did stop that about 10 years ago, but I did do it for a while. But we are seeing in the epidemiological study that was done that those that were taking carrageenan and other emulsifiers had increased risk of breast cancer and then also prostate cancer. So it must be having some type of hormonal effect on the body is my guess, and increasing these risks. So you definitely want to stay away from carrageenan. You're trying to be healthy. You're trying to stay away from dairy. It's causing you some tummy aches, causing inflammation, causing you maybe to get zits or whatever reason you're staying away from dairy. But then you're having the almond milk with carrageenan. I'm like, man, which one's worse, the dairy or the almond milk? Probably a good quality raw milk is a lot better than the bad carrageenan rich almond milk. So just
Yep.
be aware that we want to stay away from these emulsifiers and try to get a really clean source of almond milk or cashew milk or rice milk or whatever type of milk, because that's where we're mostly getting it from. We do get it from other sources, so pay attention to that. But I think most of us are getting the high amounts of carrageenan from our almond milk that we're drinking.
Yes. And I didn't know about the breast cancer risk, but I had heard a while back, and I have gut health issues a while back, that carrageenan did cause some gut inflammation. And so a couple of years ago, I had already started looking at the ingredients on my almond milk.
Mm-hmm.
And I did find some brands out there that don't use it. So some common ones that don't use it are Silk and Malk and Orgain are some good ones that you can
Mm-hmm.
look at. What I did find is it tends to be some of the cheaper almond milks that tend to use the carrageenan, and a lot of these non-dairy coffee creamers. Not like Nut Pods is good, but like I'm talking about the garbage ones, like the Coffee Mate, the ones that
Mm-hmm.
are really sweet and fun tasting and it's like candy in your coffee. Look on the back of those. Those ones do have carrageenan in them. So just looking at, I think, ingredients is important, but also like it's becoming more and more easy, I find, to even just make homemade almond milk. You can just throw a few pieces of almond in a blender, blend it up with some water and a little bit of like, some stevia or something like that to sweeten it. And it tastes great. It's still creamy. And they even have like some fun, like almond milk makers that are out there that you can buy. So you can actually avoid the whole process of even needing to buy them. And it doesn't take a whole lot of time. So I think this is actually one that I feel like, yes, I know we're trying to be healthy with the almond milk, but I think that like people are starting to come around to this, and companies are starting to come around this. And so there are more options, which I'm really, really thankful for. All right. For those of you who are listening to this and who maybe are a little bit more concerned about breast cancer due to maybe family heredity, or maybe some of the things on this list you have hit and you're concerned, you want to get maybe some testing done to just see where you're at and so forth, and you want to get a hold of Dr. Jake, you can do so. We do have a link below in the description box if you're watching this on YouTube, and in the show notes if you're listening to this on Apple Podcasts or Spotify and things like that. And that is that you can go to drjakewellness.com/schedule, and you can actually schedule a 15-minute call with his team to be able to discuss what your questions are, what your concerns are, and see if that's something that they can help you with, and they can move forward with you on that one. So really thankful for that, Dr. Jake. Are there any other videos that we have or episodes on the few other podcasts that could help women who are listening who are really, focused on preventing breast cancer?
Yeah, so we have multiple videos that we have done on various cancer like breast cancer. So if you're interested in that and you're watching YouTube, click my videos to the right. I'm Dr. Jake, and I'll see you there.